Live from the Channel 11 studios, it's Great Day Houston.
Welcome back to Great Day Houston. Okay, I'm going to ask the audience some questions, ask you at home as well. So let's get a shot of the audience right now. Before I ask, okay, do these symptoms sound familiar to you? You're tired, but you can't sleep. How many of you? Raise your hand, raise your hand. Tired, but you can't. That's just about everybody, okay? You're depressed, but you don't know why. Sometimes you just feel blue, but you don't know why, okay? Your memory isn't as good as it used to be. You feel like something's wrong, but your doctor can't help you. Okay? All right, great. Well, our next guest says instead of treating the symptoms, you need to treat the real cause naturally. Please welcome back Dr. Stephen Hotze, author of Hormones, Health, and Happiness, and his patient, Nancy Castelvi. Hi there.
Hi, Deborah.
You get a lot of this. And a lot of us will say, well, it's just because I'm working too much, or it's just because I'm aging. But the point is you can combat a lot of those things.
Well, that's what usually the physician says. The reason you're fatigued, can't lose weight, can't think clearly, can't sleep, your joints ache, your moods are stressed, is because you're working too hard or you got kids. And they go like, but doc, I shouldn't feel this way. I'm only 30, I'm only 40. Something's
nothing changed in my life.
Something's not right inside of me. And I think it's my hormones. And they'll often say, what makes you think it's your hormones? Because it happens every month. It goes in cycles every month.
Yeah.
That's why.
Well, Nancy, you were nodding your head as we're saying all these symptoms and what he was just saying, that, you know, you're saying something's wrong. So what was wrong with you, and what were you told?
I have a genetic condition of my thyroid. I've had treated all my years with Synthroid and synthetic thyroid. And with the years, you feel that it's not right. Test results says they are, so you're kept on the same dose. But what really brought the symptoms I felt when I went to the clinic, it was the hormones. I had gone through a hysterectomy years before.
So now adding to your thyroid,
added to my Synthroid, I was taking synthetic estrogen or Premarin. I was on high blood pressure medication, and 2 or 3 years before my first visit to the clinic, I started feeling very fatigued. I had pains all over my joints.
And you were a realtor, so you needed to get up and go and be active all day. And that was hard for you.
It was very difficult. I had to take naps in between clients, and I started feeling very depressed. Depression was a big issue, so I had lost interest in a lot of my daily activities. I didn't exercise. My life was just not there.
Yeah.
I kept asking my physician, you know, what is wrong? And is it the Synthroid? No, your Synthroid's fine. Your tests are normal. Well, is it my female hormones? I would ask my gynecologist. No, that's also fine. You know, your levels are fine.
Yeah, and Dr. Hotze, herein is where kind of you practice differently. When someone says no because your tests are normal, your question is, what's normal and for who?
Well,
if the patient's telling you these are my symptoms, you have to listen to the symptoms.
Yeah, right. If the patient tells you she's still having the problems, then you know the preparations or medications that she's on aren't working. So she was on synthetic thyroid, she was on the counterfeit estrogen, she was on blood pressure medication, then they sent her to a psychiatrist and they put you on?
Well, the psychiatrist put me on an antidepressant, which worked at first, but because my mind, you know, was not there, I was slow, and I was diagnosed as having ADD, not the hyperactive side.
Now you're, okay.
No, this was the space cadet side of ADD.
So, okay, and again, so now all it is symptoms.
So what did they put you on?
I was put on Adderall. Now let me tell you about Adderall. Adderall made me feel great. I would pop that pill in the morning. I had the energy to conquer the world. I would have my appointments, my clients, you know, come home and be exhausted.
Yeah.
Because
and again, it's treating a symptom, not
like
treating the cause.
And then they had to put her on a get up pill in the morning, Adderall. They had to give you a sleeping pill.
I couldn't sleep at night. So.
Okay. So you went through all of that. Now where are you at? What was the solution, and where are you at now?
Well, where am I? I called Dr. Hotze. I went to the clinic 3 years ago. July 6th was my first appointment. I kept a diary because I started feeling well so soon. I still was in a lot of my medications. You cannot stop an antidepressant, but I was tapering off. The Synthroid had gone away before I even went on my first appointment. So I was
We have
now
about 30
on natural,
seconds left. So
natural
today you
Synthroid.
are...
Today I feel great.
You're
I
on
feel
natural-
like I was when I was 20 years old.
And the key is you put her on
Put her on
natural...
Armour Thyroid, bioidentical hormones, and got her off these other drugs and put her on a good eating program, cleaned out the
That's
yeast.
it.
And she's done marvelous. She's
And I'm not
she's
medicated. I'm just back to where I was.
Taking
my
your natural
hormones
hormones.
was
Yeah.
natural hormones.
3 years later. She's drop dead gorgeous, I think.
Well, all right.
happy.
Thank you.
Thank you very, very much. You can listen to Dr. Hotze's radio show, Health and Wellness Solutions, Monday through Friday on 700 AM KSEV from noon to 1 o'clock. And for more information, you can call the Hotze Health and Wellness Center at 281. What number is that? 698-8698. Do you have any hormones for eyes? Okay, 281-698-8698. A sign that I'm turning the corner. Or you can log on to hotzehwc.com. Thank you. Wait, hold on. There she goes. We'll be right back.